morning. Uh, Thank you for this opportunity. Uh, One of the important, because I was not prepared, and I was told that I should be speaking on this how what we are doing in the technology fund. Because I came prepared for the panel discussion, which would be following this deliberations. Nevertheless, a task has been given. I have to justify that thing. One of the important things we have been all talking about technology, and the biggest example of technology is how we are implementing the PMJ program. Before the PMJ program, the first introduction to the technology was for the health insurance program. That was a true health insurance program, which was Rashtriya Swasthya Bima Yojana, wherein we did innovation for capturing the beneficiary database through smart cards. Then based on through these smart cards, we try to do transactions. A pre-approved package rates were decided and transactions happened. That was a brief introduction into the technology aspect, how technology can aid in providing access to healthcare services. That was just a highlight to that. Building on that, when we migrated to PMJ program, the biggest challenge was that what kind of transaction software and what kind of things we should be having, so that from the identification of the beneficiary to the discharge of the beneficiary are seamless. There are many options. I'm talking about 2016-17 when we were struggling and we were having a lot of portals. You name a program and you have a portal for that. At that time, simultaneously when 2017, when this was started and it was launched and it was decided that we should be at least not reinventing thing, but adopting one of the software which is being used by different programs. Because from 2006-7, this health insurance scheme has been implemented in one form, other form by different state governments, union territories. And taking the experience from that, in the challenge mode, one software was agreed, and that software was eventually rolled out as the first HBO1 package and the software which was rolled out, and subsequently a task was given to upgrade that software and the revised version, which you would be seeing claims exchange and other, that's the advanced version of that. But having said this, why I'm giving this background, because just to give an emphasis that how the technology has paved way for, it has showed a way to us. The other aspect which has happened after that, when so many portals were there, we thought that how to see that how these portals are integrated. At that time, we thought that let us have a stack, health stack, and see that how this all the information they talk to each other. So after a lot of consultations and other happenings, we created a national health stack, so that a repository of information is there, and the vision was that through a common identifier, we can at least all these portals, all the information can be stored at one place, and with common identifier, they can be talking to each other. All the databases and others will be talking to each other. Subsequently, this national health stack, this provided inputs to the national digital blueprint, which formed the architecture for the national digital health mission. The committee was there, the blueprint was created, and the blueprint has all the building blocks for having a digital health infrastructure in the country. And few of the aspects have been rolled out as a national digital health mission. You see that how we are integrating the technology in that. We talked about the health stack, in which we have a vision to have a common identifier. Now you would be seeing ABHA IDs, which would be embedded into the health records. Electronic health records, we have been struggling for the last 1.5 decades when the Clinical Establishment Act was enacted, in which electronic health records have been mandated. Many of the states which have adopted that, so they have to have, the establishment has to have an electronic health record. And this electronic health record would be very useful if a common identifier, that is ABHA ID or the ABHA account, is embedded into that, along with the identifier of the health institutions and the doctors. So work is in progress in that direction. You see that how the technology and other things can pave a way into that. Visit any of the private institutions, hospital, big hospital, you will find people with a jhola of medical records, and they will appreciate if the doctor will see all the records. They carry that thing. But with the advent of this newer things, the mission, mission envisaging to embed the ABHA IDs into all the records. You see that what kind of ease of getting treatment, ease of providing care by the doctors and other things can happen. So this is one of the enabling thing which we still work in progress, but nevertheless we are moving in the right direction. You will see that how the seeds which have been sown over the last many years that start yielding results, and results are quite obvious and visible also. And everybody is talking about that. That means a buzz is created around. If a buzz is created around, people will innovate. They will try to see that how to do things differently. They will try to engineer things and see that the results are in favor of creating a public good, and so that it is beneficial to all. I will stop here. Thank you very much once again.